Eyesight is one of the most precious gifts we have, and there is much to consider before making the commitment to improve how we see the world. Advancements in vision correction technology have turned once complicated and invasive treatments, such as lens replacement for cataracts, into procedures that are now simple, safe, and effective. Today's patients have extremely fast recoveries and can now live free from glasses or contacts, often seeing better than ever.
Common misconceptions about cataract surgery and lens replacement. The most common misconception is that a cataract is a film or a membrane or something that I peel away, but that's not a cataract. So rather, a cataract is a clouding of the lens that sits inside the eye, behind the colored part of the eye, behind the pupil. At the end of the day, the eye simply takes the picture, the brain sees, and because the eye is a camera, it has a lens inside of it, and that lens when you're born is clear. But over your lifetime, the lens becomes kind of cloudy and yellow, and it doesn't allow as much light in, and it scatters light, so people get glare and they don't see quite as well. That's a cataract. So a cataract's not a growth on or in the lens, it is the lens. And once a lens is yellow and clouded, we have no way of unyellowing it or unclouding it. It's the replacement of that cloudy lens which no longer works. We take it out, throw it away, and in its place we put a replacement lens. And that's the key to success with the surgery, is to make sure you pick the lens that's actually meant for that person's eye, because we have many different types of lens implants. There's not one best fit for everyone. As far as improvements in technology and advancements in vision correction technology go, I think the most important take-home point is that there are a lot of tools in the toolkit that your vision correction surgeon has available. Things have changed, and sometimes the opinions were in fact wrong, and other times what was right 10, 15 years ago is no longer accurate today. So, for example, for the person who is too nearsighted for LASIK, we have implantable lenses that can go in the eye. In a 3-minute procedure, patient walks out of there being able to see. But go see your doctor and have them tell you what their choices are. They may be a candidate for things that they had no idea even existed.
Dr. Horn is the founder and owner of Vision for Life, Nashville's premier vision correction center, specializing in advanced technology lens replacement for ailments such as cataracts and presbyopia and state-of-the-art LASIK eye care.
When I was in high school, I was not thinking about being a doctor. I was thinking about being a professional drummer. My mom was very sick when I was young, and she ended up dying from cancer at the age of 36. I had spent many years, at least 25% of my life, with my mom in and out of hospitals, literally watching her slowly die. And that probably is why somewhere deep inside I had this desire and urge to become a physician. My path to Vision for Life ultimately first went through academia, and I was at Vanderbilt University for about 8 years as their, in essence, lead cataract surgeon. After about 8 years at Vanderbilt, I left there and I founded Vision for Life.
Equipped with the latest state-of-the-art technology, Dr. Horn provides advanced vision correction in a professional, personal environment and takes the time to tailor treatment that best meets a patient's visual needs.
Vision for Life is based upon several guiding principles. One is that we are going to use the most advanced technology available to correct vision. It's also founded upon guiding principles of what it means to be a doctor. And I try to be the doctor to them that I wanted doctors to be to my family. And so I base decisions on, is this what I would do for my family? And if the answer is yes, then it's certainly something that I can offer to my patients. Another guiding principle is that I felt that if I hired the best staff, that they would stick with me and they would have ownership in this practice, that they would want the best kinds of outcomes for these patients just as if they were the patient or their mother or father was the patient. And so what you see when people describe my practice, they don't usually describe me first. They usually describe my staff first. Those are the guiding principles of Vision for Life. Each patient matters. Their experience matters. I'm trying to provide the care that you would want yourself, that you would want for your family. I'm trying to provide the care that I want for my family.
I've been considering LASIK corrective surgery for many years now. In fact, it's something that I've been considering for almost my whole life, since I was born with pretty rough vision. I considered a few different procedures with Dr. Horn. The first was just classic standard LASIK, and the second was actually the Contura LASIK, which is with a slightly more advanced and newer laser that could be tailored more individually to my eyes. So actually, it was the Contura LASIK that I ultimately decided to go with. At first, I wasn't sure if I'd be a good candidate for both of those procedures, but fortunately, after some extensive testing here at Dr. Horn's office, they determined that I was a good candidate for both. All the instructions they provided were very clear, very easy to understand and follow. All of my initial concerns and fears were quickly dissuaded by the team, and their professionalism is what gave me the confidence to know that I'd be well taken care of here. It's definitely a life-changing procedure to be able to see clearly without any form of enhancement from glasses or contacts. It's like a dream come true.
I was diagnosed with a very slight cataract, and so I decided at that time we needed to deal with that. I talked with Dr. Horn, and we discussed that that would be a good lens replacement for me. At the same time, we were doing the cataract surgery, so we had both done at the same time. Recovery process was fairly quick. Went in and had the left eye surgery 1 week, and 2 weeks later the other eye, but within 24 hours the correction was there. Vision for Life has been great. They followed up with me, and they continue to follow up with me even now.
As Vision for Life looks toward the future, my goal is to maintain a laser beam focus on the patient and getting the best outcomes and using the latest technology that works and is safe and effective in order to improve how people see.
If you're struggling to see, you may benefit from vision correction. A clear and more vibrant world awaits. Learn more about Vision for Life, Nashville's choice for lens replacement and LASIK procedures. For more information or to schedule your consultation, go to visionforlife.com or call 615-800-2020.